Yeah, we can all come on up. It's been said that one of the most complex environments that one can work in is an academic medical center. There are multiple roles, there are multiple hierarchies, both within the professions, as well as academic, as well as business side. They speak different languages, they use different terminology. And so far, we have heard from some incredible women leaders who, about their own individual path. But now we're going to talk about some incredible women leaders right here at Stanford who have shaped a culture within an organization that's extraordinarily complex. I'm going to introduce our three panelists. Each one of them has an extremely distinguished career, but I'm only going to give a little bit of that as I introduce them to allow more time. I have next to me Dr. Kelly Johnson, who is the Vice President of Patient Care Services and Chief Nursing Officer at Stanford Children's Health. Then Dr. Julie Collier, who is Director of Enterprise Resilience and Director of Clinical Pediatric Ethics at Stanford Children's Health. And last but not least is Dr. Christy Sandborg, Professor of Pediatrics and Rheumatology and a physician executive both at the University School of Medicine and Packard Hospital. So I'm going to ask a couple of questions of our panelists and then open it up for some questions from all of you. Dr. Collier, there's a lot of interest in what's been done at Children's Hospital and Health related to building resilience. Please tell us about the work that you've done to improve the work environment and the culture and to promote both personal and organizational resilience.
Thanks, I'm really glad to be here. So I'm a pediatric psychologist and I've been at Packard for nearly 29 years now, mostly in patient-facing roles. And about 5 years ago, I had the wonderful opportunity to move into a newly created role as Director of Enterprise Resilience, where I was really able to blend my psychology background and my emphasis throughout my career on building resilience in patients and families, and also my experience as being co-chair of the ethics committee and really sort of understanding the pain and the suffering on the part of the clinicians and really sort of bring the resilience and the sort of understanding of the stress of being a frontline provider together. So when I moved into this role about 5 years ago, it was really a very sort of ill-defined space. It felt a little bit like the Wild West, a lot of wide open territory with a lot of sort of settlements of really good work happening, but happening in a very siloed way. And at that time, the conversation was still more focused on personal resilience and what you needed to do yourself as an individual clinician to take care of your own well-being. So in this role, I went about trying to create more alignment in that work and looking for how we identify shared values and goals in this work. About 2 years ago, well, in 2018, the work really took a big shift in that the organization identified resilience as part of one of the organization's core goals, the Respect for People goal. For the first time, resilience of our team members was on the map, if you will. And related to that, we conducted our first organization-wide wellness survey, which was based on the Stanford Physician Wellness Survey that the Stanford WellMD Center had conducted. And this was the first time we had a sense of the rates of burnout and professional fulfillment across our organization, both in clinical and non-clinical team members. And that work really is very grounded in the idea that, that the well-being of our organization goes well beyond personal resilience, although that is incredibly important, but it's really about the culture that we are in and creating a community of shared values with leadership that promotes professional and personal well-being and really cultivates a community of compassion and caring for ourselves and each other. And so at the core of this work really is values and being grounded in our values. And I tend to think of the imagery of a tree as representing sort of the core of this work, with the branches and the leaves of the tree being all of those personal resilience strategies that we use, the mindfulness tools that we use, our good sleep, our healthy eating, our exercise. But the roots of the tree are our values, and the deeper those roots, the healthier the tree. But it's also about the richness of the soil that tree is in, and the ultimate thriving and growth of that tree is really related to that soil or the culture. So with this focus and commitment to values, we've really started to see a shift in our culture. We're about to launch the Office of Professional Fulfillment and Resilience in the organization, where my team will really help to be thought partners and collaborators throughout the organization to really advance this work. And we're starting to see very significant signs of change. In fact, just yesterday I had a conversation with one of our frontline clinicians who had an experience that was incredibly distressing and activated for her some secondary traumatic stress from a case a couple of years ago. And when I kind of connected those dots for her, she said, "You're right." And that was back when we didn't talk about these things. So there is a shift in being able to acknowledge the suffering that the clinicians experience, and about starting that conversation where we accept that suffering and then work to create a culture that supports well-being based in values.
Okay. Dr. Sam.
So I've been a physician now for about 40 years, and I've always been in academic medical centers and happen to be always in children's hospitals because it's great fun taking care of kids. In that journey, as I reflect on it, I started as really a lab researcher and a clinician taking care of kids, and moved to a clinician scientist doing clinical research and taking care of kids. But in the last 12 years of this career, I've realized that I can't leave and retire unless we fix certain things about taking care of patients. We are now, as Julie has described, poised at a time where our organizations in the School of Medicine, both the two hospitals, the adult hospital and the kids hospital, as well as the whole medical faculty, are beginning to recognize that it's really about the people and the people's interactions that make our work so fulfilling and so successful. We have, and in our work in medicine, it's all of our product is the care we provide patients. Whether it's the patients of today, those patients we've developed a covenant with to care for them, whether it's the patients of tomorrow, where we're doing the research, even like the basic biochemical research that Suzanne has talked about, that will impact the patients in the future, and the patients of the true future, which is training our children, our trainees, our medical students, our residents, our PhDs, to actually take the successes to the next level. And so it's all centered around the patient. We just sort of look at it in different ways. So this was sort of an epiphany for me. And I realized that in this incredible explosion of technology, that the relationships between patients and families and everybody who works across the whole medical center that contributes to the care in some way or other of patients was at risk, because we really need to look at the relationships. Now, I think this is probably, maybe it's because I'm a woman and I just think this way, having lived this and knowing that relationships that I develop with people and influence people are my way of getting things done, because it doesn't really work to be bossy sometimes, but it really works to be firm, kind, and courageous, as our chairs exemplify. So that at that point, I stepped back and I said, okay, so what can I do for the Children's Hospital? And so I went into this phase of looking at burnout, professional fulfillment with a group of people at Stanford Medicine, and then help translate that to the Children's Hospital for everybody, to look at what we could do and where were we missing the cultural piece, the lived work experience that would promote true well-being and meaning of work for everybody. My focus has been on trying to understand the barriers to a culture of well-being and a culture of resilience. I've worked for many years in coaching and helping faculty and other physicians and other people be their best self. One example of this is in our work, it is really hard. Mistakes happen, not all the time, but certainly some of the time. And many people in our work are so mission driven that the idea that you could have done something that harmed either a colleague or a patient shakes you to your core. This is that moral distress and injury that we feel when this happens. One of our problems has been traditionally in this very academic world where you have this scripted thing, you are never supposed to make a mistake. You're always supposed to know what you're supposed to do. And what happens is when an error occurs, one of the immediate old-fashioned ways to respond with physicians is shame and blame. So about 5 to 6 years ago, this really came to the forefront when we realized that this was our culture. It could be thought about as a blaming culture, at least for physicians. And that was our automatic go-to place in everything. So we worked on how do we change this to a positive culture. We call it the punitive to positive movement. And instead of saying, Dr. X, you made a mistake in a diagnosis. You made an error in a diagnosis. We said, how did this happen? What can we learn from this experience? Nobody goes to work thinking, I'm going to harm a patient today. That everybody wants to do the best they can do, but things get in the way. There's too much to do. You're incredibly busy. You're worried about the patient down the hall who's really sick and aren't maybe focusing. You have sort of this situational awareness problem. There's many, many factors that contribute into making a human error. The systems don't work. The technology messes up. So many different ways. So what happens, what we've done is we've adopted the high reliability principles of the aviation and nuclear industry to actually help us be more discerning about what the drivers of these errors are. Errors or near misses. We look at both because we can learn from both. Doing this depersonalizes it, removes the blame and the shame. We don't call them errors. We call them opportunities. How can we make it so this doesn't happen again? What can we put in place? And this has been hugely beneficial in our physician world, where we know that people feel that they will not be blamed. Then on the other side of the coin, there are things that we do need to deal with. We do need to be active, and this is also has been part of my role, not only help people who make an error forgive themselves and forgive others, but remember so you can make it better. But what about people who maybe really struggle with some more negative behaviors, like bias, like harassment, like microaggressions? How do we actually alter those behaviors? And that's another area that we are working on, and we have a lot more work to do in this area. And I'm so delighted to be here and to meet people like, I'm not going to get the name right, Derica? Yeah. And other people here who I can walk across the quad and catch her and say, hey, you need to come over and help us in our hospital because we need you. And we need to eliminate these biases and these microaggressions, and we need micro-inclusions. We need ways to fix this. So those are my thoughts about how we can improve resilience. We have to improve what we can, and we have to eliminate what is toxic and really interfering with our ability to be resilient and have a culture of well-being.
Thank you. Dr. Johnson.
So I actually have been a nurse for 37 years, and 27 of those years I have been in a chief nursing officer role.
If you could use that.
Okay,
Sorry.
got it.
Sorry to interrupt.
No, that's okay. So I've been a nurse for 37 years, and 27 years of those as a chief nurse. I am one of those people that did not ever intend to get into administration, but really wanted to make sure, from a leadership perspective, I could have a big impact on the environments that I work in. And so I've been passionate about the work environment, that we keep a caring and healing environment for patients and families to receive care, and for the care team to deliver that care, where we have unconditional mutual respect of each other as professionals, and respect the impact that the work has on each of us as we go to work every day. And as an executive, my intense sense of responsibility to provide those types of work environments. So I want to talk a little bit about, I think, the three areas. I've been here 4 years. The areas that we've really focused on in our resilience work. So the first one is really looking at our executive commitment to building a culture of respect for people and a moral and ethical culture in which we practice. So Julie mentioned a lot about our values-based perspective, and really ultimately what's in the best care that we can deliver for our patients and families through the type of environment that we create. So we have, Julie alluded to this as well, our executive team is 100% committed to and engaged in creating an environment that fosters ethical practice, intentional integrity, moral courage, and the ability to create these environments that support and sustain all of the workforce, not only physicians and nurses and clinicians, but the housekeeper who is, committed to preventing infections in the organization and makes those deep connections with patients and families. Everybody has a different level of impact from the work that they're doing. So we do look comprehensively at the whole organization. So our board is also very committed to our resilient culture and building a culture of psychological safety, moral courage, and an environment that respects each individual that works in the organization, as well as our patients and families. Julie already talked a little bit about respect for people. We have what we call our house, and one of the core foundations of our house on how we conduct ourselves in our organization is respect for people. It's a foundational statement that we've made from the board and the executive team to the entire organization, that we can't do our work without our people, and unconditional respect for everybody on the team, and building top-level goals in the organization that commit our resources and our focus on building a resilient environment. how do we look at the data that we obtain from our surveys that Julie spoke about and drive the work in the organization to commit to making improvements in the area that reduce resilience and improve burnout in our patients, our team members. The second thing is the second focus is our strategic work around culture change. Again, my colleagues have alluded to that, but really we have compassion as one of the words in our mission statement, and we don't want it just to be a word in our mission statement. We want to practice in and deliver a care in an environment that is embedded and reflective of the compassion of everybody that delivers care in the organization. And we've done that through commitment to our Office of Enterprise Resilience, to programs and cultural commitments to each other, to ourselves, and to the patient's family around a caring environment. We've done a lot of work around moral courage, and starting with a policy, and a policy is just a policy in a book if you don't embody it. But part of moral courage is each of our individual rights and responsibilities to speak up when things are morally distressing, and for those of us individually and at a level of higher responsibility to accept that feedback when we have an environmental shift that we need to make. And I believe over the last 4 years since I've been here, we've made huge strides in creating that type of a culture. The last thing one other thing I want to mention around strategic work that's relative to the theme of the conference this morning. One of the things I think that we've all talked about around building psychological safety, a culture of safety, moral courage, and resilience. Some of our male counterparts, when they bring some of this information forward that we are not treating each other with respect, or we need to pay more attention to safety, it's really seen as passion. When we bring these things forward at times, it's seen as emotion. So we're really trying to work through that sort of gender bias around we're bringing up the same issues and working towards the same end, irregardless of if it's a female executive or a male executive bringing the information forward. So we just thought we'd throw that in there as an example of what we do face with that. And I do believe that, as I sort of mentioned in my question, it's about diversity and inclusion and respect for everybody, no matter what role you are in or where you fit in the hierarchy or what role you have. So I think we have all kinds of diversity and inclusion work to do, again, around gender bias, cultural bias, all of those types of things. But in healthcare, we do have a lot of bias about, even within medicine, the attending, the fellows, the residents, the med students. Are people feeling psychologically safe and supported to bring up things that are either morally distressing or safety issues? Physician to nurse, executive to frontline worker. So how do we sort of balance that playing field so that we have this culture that can support everybody within the culture to feel safe and well respected within the culture? And then thirdly is really working around this idea of integration of, maintaining humanity in healthcare. And how do we work from this place of caring and compassion? Again, compassion and caring for ourselves in this hard work that we do, for each other, and understanding the impact of the work and the conflicts that we might have. We have a home life outside of our work, and then the compassion and caring that we create to people that in many instances are facing the worst day of their life, their babies in the NICU or in oncology, having your child die, and really dealing from a place of humanity and caring and compassion in those cultures. So that culture change has been very important to ground ourselves in that work of compassion and ethical integrity. So I think I'll stop right there with that comment.
Thank you very much. You each have touched upon this a little bit, but I wonder if you might just expand a little bit about what inspired you and how has your own thinking evolved as you've embarked on this very important quest to build a culture of resilience, and how has that affected both the providers and the patient care? And I'll do
go
reverse
ahead.
order here.
Yeah, we'll do reverse order.
Yeah.
So I think for me personally, there are clearly, I never want to forget where I came from and my upbringing and my early days in my work. And, I feel honored and privileged every day that I realize I'm really one of the 50 nursing leaders who is at an independent freestanding children's hospital. So you don't want to work in that sphere, you want to remember the work that you do in the beginning. And so my past and my history inspires me to stay connected and grounded in the work that I do. And then my real inspiration are the folks that I work with every single day. And the responsibility to really maintain and foster and build and support a culture that respects and values everybody that's in the organization, whether they're a patient, a family, a housekeeper, somebody that has to tell somebody they have to pay a big bill. I mean, we all have hard work to do, and that's really my inspiration. And then thirdly, my colleagues. I work with some really amazing and fantastic people that care deeply about the future of healthcare and our humanity and the work that we do every day, and I think that's inspirational for me. Are yours working? Okay.
I have so many different directions I could go in response to that. I think that I too feel very privileged to do this work. It has felt like a privilege. Sort of the close to 29 years that I've been in the organization, some really amazing and wonderful things happen in our organization, and there are some really amazing people. I think this work, though, has really highlighted for me the connection between staff well-being and the outcomes for our patients. And as passionate as I am about supporting our teams in doing the work that they do, it really does feel that it is truly in service of our patients and families, and there's incredible purpose and meaning in that. The other thing I will say, Kelly sort of mentioned the gratitude of sort of working with amazing people. One of the things that we looked at in our wellness survey was gratitude, and one of our findings and discoveries was that gratitude was one of the high impact drivers of professional fulfillment in the organization. And it's not just gratitude in general. We looked at 3 types of gratitude. We looked at perceived gratitude. Do you feel valued in the organization? Do you feel that people are grateful for your role? Received gratitude. How much gratitude and appreciation do you actually receive? And then expressed gratitude. And of those 3 types of gratitude, the one that had the most impact was expressed gratitude. So it's actually really a great thing to come to work every day and think about gratitude and different ways to express gratitude. And I'll express a lot of gratitude for the women on either side of me, and their partnership has made this journey incredibly fulfilling.
So do you want to just add a few more? And I think we may have time for a few questions.
I will just say that I'm inspired every day by the people I work with and the movement that we've been able to create in the last several years. About when I started sort of thinking about women and faculty and challenges like around 2010, 2011, I and a few other people, Hannah Valentine and other people, we felt sort of like, we need to move forward on inclusion and bias and underrepresented minorities and women's voice. And even in a medical center, which is like about 3/4 female because of the workforce, this was this was not really appreciated to the same degree. And I think in the last several years, since we have worked together, I think, has really been a turning point for the institution and our inroads into changing the culture. There's still a lot of work to do, but there are so many people who have, now we talk about all the time, psychological safety and unconscious bias and all of these words that mean, that are the underpinnings of really successful teams and professional fulfillment and what really makes us great. It's a sea change, so I'm going to express my gratitude to you guys and all what you have brought to this.
Okay, we don't have time for questions, is that what I'm hearing?
We can take 1 or 2 questions, yeah. Okay. Questions about that?
I didn't hear you, I'm sorry. Any questions? Yes.
Hi, I'm Melissa. I graduated in '07. I do remember that right in the beginning of medical school, I felt like Stanford, the medical school, had an emphasis on compassion. And having been a resident, I would say that there is a shift from when you become a medical student to when you enter the academic medical center. Knowing that you get that training, you go through that shift, and maybe you see that the systems aren't in place to support you as everything you thought you could be as a medical student, you start to feel challenges. And I've heard you guys talk about the culture of resilience and creating policies and systems. What is being done for those trainees at that level? Because I imagine they're all going to someday become chairs in their respective hospitals, and that they could, pay it forward for someone else. What are some examples that are being done with the trainees to support, well-being?
Do you want to start?
So I think that there's a huge amount that is being done in this space by the training programs, by the institution, by the lived work environment, and because of our awareness that some of the most challenged people in our organization are the trainees, the most burned out, the most, working really hard. With the changes in healthcare, it's scary what's going to happen in the future. And so there's a huge amount of effort on that, and a lot of the time that we spend is on focusing on, supporting them individually, in groups, creating a lot of work on the lived work environment to make it just easy, more fun and less burdensome. So I think that's one of our very highest priorities, especially in this academic medical center.
Another question?
I have a question for Kelly. It's very practical. So have you ever, in regards to how, our presentation is treated, women are emotional, men are just passionate, right? Have you ever called them, I go to meetings all the time, and they say, Jane, hush down, you're getting emotional. Have you ever called them on it, and what kind of reaction do you get? I'm trying to think of a
So we don't know each other very well. I'm pretty bold and courageously authentic. Not a problem with me. So I pretty much speak up and speak my mind and have one-on-ones with people if I think there was something that I can help educate them on how they could represent me better.
Okay.
All right.
I think we'll have time in a bit, but I want to thank these 3 wonderful women leaders and your colleagues for what you're doing to shape a culture of resilience and make it a more happy place to be, but also to provide wonderful care. Right. So thank you very much.